Hello, this is Dr. Gay from First Look MRI, and this is a 37-year-old female with complaints of right hip pain. She has a complex cyst of her right over here that may be contributing to some pelvic pain, but on her x-ray they saw a bone lesion in the right femur. We're worried about it, so they did an MRI here with and without contrast. And this is a large field of view coronal stir sequence, so anything abnormal should show up really bright in the marrow. So this is the right femoral head. Here's the neck, here's the shaft, and we do see that something looks a little funny in this region here. This is where the bone lesion was on x-ray. Apparently on x-ray it stood out much more than here. Here the bone looks pretty normal. There's just a little curvilinear black line here. There's a little bit of bone sclerosis. We see a little white pocket here, a little bit of fluid within the lesion. And as we go towards the front of it, we see a couple other fluid pockets here. And again, if we go backwards here, this is part of the lesion, but here it looks like it's very similar to marrow, so sort of a ground glass look to it. Now on a view here, this is a T1 weighted image. Usually bone tumors show up really well on T1 weighted images. They really stand out. But in this case, this is where the lesion is. We see these little curvilinear bands of bone sclerosis here, and the marrow is very similar to fatty marrow elsewhere, so kind of a homogeneous marrow pattern. No really abnormal findings except for the curvilinear bands and these little fluid pockets. So we're going to do a post-contrast image to see if any of this stuff enhances. We'll do a non-contrast T1 first. So this is a non-contrast T1 image where we've done fat suppression. All the fat has gotten dark, and we see that again on this view things look pretty homogeneous. This is the bone lesion. These little fluid pockets really stand out here on this. And now we're going to go to one more. This is the post-contrast image. We're going to look for enhancement of this. And here's the lesion again, very similar to the other marrow. No significant enhancement. This is a little complex ovarian cyst over here. So this is a good example of fibrous dysplasia. Fibrous dysplasia has little swirls of bone sclerosis. Sometimes it has little cystic pockets like this. And usually shows no significant enhancement. And sometimes they're hard to see on MRI like this. X-ray, a lot of times they'll stand up, they'll really stand out because of the bone sclerosis. So if something looks pretty ominous on X-rays, you're very nervous, but on MRI it looks, hey, not too bad. It may be fibrous dysplasia. Other things, this is non-expansile. There's no abnormality of the cortex. So just a benign, non-aggressive bone lesion, again with cystic components and regular ground glass, normal appearing marrow through parts of it. Think about fibrous dysplasia.